Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
Hello, everybody. What is animal chiropractic? Animal chiropractic is allowing your body's innate ability to heal itself. When should you start chiropractic? At birth. How often should you get adjusted? As often as you're subluxated. We had some puppies in last weekend. Mama wasn't milking very well. The owner didn't think. They were going to be here for a while because they brought a bunch of dogs. So first thing we did was adjust the mother, and we adjusted one of the babies that was unable to latch. A baby started immediately to latch, and the mother, within 30 to 40 minutes, she had relaxed, and the owner said, "Oh my gosh, I think she has more milk now than she did before." Rechecked Mama, she was good. Rechecked the baby, she needed an adjustment. So adjusted her again. That was about 15 minutes. The baby rechecked her again the next time at about 15 minutes. She was okay. About 45 minutes, she needed an adjustment, and then she was pretty good. So, how often? As soon as you get subluxated. We know that the presence of a vertebral subluxation puts pressure on the nerves. Once that nerve has pressure on it, we start to get nerve degeneration and decreased transmission within 40 seconds. Within 4 minutes, we'll have a 60% reduction of nervous transmission. That's proven. It's like your leg going to sleep. So as soon as we remove that vertebral subluxation, the nerve flow can start to generate. We know that if we immobilize a joint, which is what a vertebral subluxation does, that joint's not moving properly. If we immobilize that joint, we'll start to get some microscopic changes in that joint within 7 days that are still there within 6 months. So we're going to get some microscopic changes that stay for a long time if the subluxation is there longer than seven days. So how long should you get adjusted? Ideally, as soon as the vertebral subluxation occurs. Maybe once a week, at least once a month. So, we want to be subluxation free to achieve optimal wellness and health. That's our goal, because the body heals one way and only one way: above, down, inside out.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Helping others experience an abundant life with the gift, art, and blessing that is animal chiropractic is our sole mission at All Creatures Every Spine. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to provide the highest level of chiropractic possible. And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome. We all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro Website Pro, Tony Seymour. He's a professional web designer, and his team at Chiro Website Pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the number one hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com and make sure you ask them about the special ACES discount and let them know Dr. Amy and Dr. O sent you. You'll be glad.
Your active dog needs more than water to rehydrate. Replenish Dog Water Supplement is an all-natural powdered water flavoring, prevents dehydration and provides vitamins for your dog. Created by a veterinarian and rooted in science. Give your dog the care they deserve with Replenish.
Standard Process is a third-generation family-owned company in rural Wisconsin. You could say we just make nutritional supplements, but we know we're changing lives. We grow ingredients on our own certified organic farm without pesticides or herbicides, because we think they should be as close to nature as possible. Quality is our priority. That's why we do everything right here, from hand-picking the seeds to delivery, so you know exactly what goes into every bottle.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Welcome, everybody, to another episode of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O, and today we have Dr. Callie with us. Tell us a little bit about yourself and your practice.
Yes. So I'm Callie Horstman. I am a human chiropractor first, and then went back to school to do animal chiropractic. I practice in Wisconsin on the Minnesota border, and lovingly calling myself the pediatric and puppy chiropractor. So it's been really fun. Yeah.
That's a nice marketing.
Yeah. You know who told me that actually? Molly Hamilton. She actually
was like,
call yourself the Peds and Puppies Chiro. And I said, you know what? I'm going to start doing that.
There you go. Yes. Awesome. So what's your biggest win with animal chiropractic? Let's start there.
Oh my gosh. I feel like for me personally, it's probably on a very personal level. My dog, Belle, she was probably 10 months old at the time. She fell out of our car going 50 miles an hour. So, I do the whole, I let my dogs sit in the car, the windows down, their heads out the window, they're living their best life. Well, Belle decided to fall out of the car, and it was not a fun time. So I think my biggest win is just being able to see how helpful animal chiropractic is for me personally. But there's so many wins that I see every single week that animals are just incredible. They respond so well to chiropractic care, and they're like little miracles every single day. And so it's just so fun to see that every day in practice. But yeah.
Yeah, cool. So no one dog or one horse or?
I'm trying to think if I have one. There's just so many because there's so many things that do well. Or I even think about the patients who I have who don't necessarily, we definitely change their quality of life, but they don't get rid of their limp or they don't get rid of something. But chiropractic has still impacted their life drastically. And these parents are still contacting us being like, thank you so much for pointing this out, or thank you so much for spending that time with us. And it's just so nice to see that in chiropractic and just being able to help animals on another level too. So I just feel like there's so many. I feel like there's way too many.
All right. So, do you ever have patients, like parents, puppy parents, as you call them, become people patients?
Yes. And I need to get a better thing, like a better system in order how to like recruit more. But yes, it happens more often than you think because they see that we're doing such a good job with their pets and they're like, oh, you're like actually really thorough. Like maybe you would do the same thing for me if I came in and became a patient. And then oftentimes, actually more often than not, what we see is that people will struggle because their dog is having mobility issues. And so they're lifting them up and down the stairs, lifting them up and out of the car. And they actually are having back issues because of that. And so I'm like, oh, I actually know a person who could help you with that. We could just get you in together if you want. And then that way we can adjust you and we can adjust your dog at the same time. And it seems to be a really popular thing. So that's cool. And lots of people who are bringing their animals in for chiropractic care have never been to a chiropractor. And so I think it's crazy that they're bringing their dog to the chiropractor, but they've never been. And I'm like, we should change that. Like that's an opportunity for me to be able to open that door for them. And yeah, so it's been really fun.
So we have, I know one practice that only accepts referrals from dogs.
Oh my gosh, that's awesome. That's crazy.
So yeah. So just think about that is all new human patients must be referred by their dog.
That's amazing. I love that.
So there's your marketing for how do you get that to happen more often. You just put that note up on the board, you know.
Yeah. Well, and you know what's funny? Now that we're talking about this, one of the biggest things that we see pets for in the office is when the parents have a new baby. I can't tell you the amount of times that has happened to us in our practice is that when mom and dad bring in a new baby, it never fails that like 2 weeks later, their dog has a limp, their dog had a seizure, their dog has a disc issue or something. And they're like, we don't know what to do. Like we've tried everything and it doesn't work. And I'm like, well, yeah, you had a huge emotional stress. There's a huge change in the way that, you know, they're living their life and the attention that they're getting and all of that stuff. And so it's just interesting that I think 1 week alone, we had 3 or 4 animal patients just like that, where they're like, yeah, we just had a new baby. And I was like, oh, well, how's your baby sleeping? Like, is your baby doing well? Great. Like we can help you if they're not. And so it's a really good segue into that too. But
yeah. So yeah, I thought that was kind of cool because she had come to class and she is a human chiropractor. She trained as a human chiropractor, but she was pretty sure she was never going to adjust a human.
Oh my gosh.
And now she adjusts about 100 a week.
Yeah. Wow. That's
awesome. And I was like, I thought you weren't going to do that. And she's like, oh, well, they all have to be referred by dogs.
That's awesome. But then you know that those are your people, you know? Like there's no fight about the typical things that we have in practice if your patient's already under that expectation of like, this is what we do.
Yeah. So it's kind of cool. So what's the difference? How different is now I know the philosophy behind adjusting children and chiropractic and animals are the same, the philosophy, why you would do it. But what about the techniques? Are they?
Yeah, I would say that, especially me coming, like being pediatric certified first, I had to get really creative as far as like positioning. And, you know, kids don't necessarily always sit still. So being able to be a little bit more mobile, I think really helped me with animals because not every animal is perfect and sits still. A lot of them do. A lot of them love it. Like they come into the office, they know exactly what's happening. They're like, I'm going to hop right on the table. I'm ready for my adjustment. I'm like, this is amazing. And then some are not. And so just getting into that positioning has been super helpful and crossed over, I would say. And then also as far as technique with my pediatric patients, you kind of have to get in and get it done. And because not every time are they going to like their adjustment or if it doesn't feel great. And so it's been really helpful for animals too, because same thing for animals. Sometimes you get into a spot and you know that they're not going to like it. You have to get in, you have to get out. And that's why we do so much schooling. And that's why we do so much practice is because, you know, that's what we're trained in doing. And so it's not about the amount of time we spend with them. It's about the quality of the adjustment and knowing when to adjust and where to adjust. So, yeah.
So you're PED certified.
Mhm.
If there was a diplomate program in animal chiropractic, how important would that be?
Yeah, I think that would be super beneficial just because it really sets you apart. I get so frustrated in like our community of when people are like, yeah, I see PEDs. Yeah, I can see this, or yeah, I can do whatever. And I'm like, yeah, you can. Like, a monkey can press a button too, but I want someone to be like certified in what they're doing and like actually put in the time and effort to become a master in that thing. So I just had a conversation, a different group that I'm in. This girl thought that she could just take an animal class over the weekend. She was like, I just want to take some animal CEs. And I was like, are you animal certified? And she was like, no, I just want to know for my own dogs. And I was like, what? That doesn't make sense to me. But, it is what it is.
We get that call all the time too. People, how much? Well, it's 15,000.
Mhm.
Well, that's a lot. Oh, you'll pay that back. You'll make that money back easy.
Yes.
It won't, easy. But, I only want to adjust my own dogs. Well, then call somebody.
Yeah.
Exactly. That'd be like, I have 3 kids. I'm a veterinarian, so I just make sure everybody remembers that. I don't adjust people. I only adjust animals. But surely you could show me enough that in a weekend, if I came up and spent a week with you, couldn't you teach me enough so that I could just adjust my own kids?
Mm-hmm. And it's the same. That's what I told that girl too. It's the same thing.
Yeah. No, you could, but it wouldn't be in my kid's best interest.
Mm-mm.
Somebody told me the other day that we can lay a patient down, whether it's a human or a dog, and we can tell a physical therapist to push there, and we can tell a manipulator, an osteopath, to push there,
Mm-hmm.
and we can tell a layperson to push there, and then we can tell an animal chiropractor to thrust there, and all 4 of them will probably move the bone.
Mm-hmm.
Depending on how much gas is stored in that joint, all 4 might get an audible.
Mm-hmm.
But only one of them is going to change brain.
Mm-hmm. Yeah. And that comes back to knowing, like spending all that time and mastering that art of chiropractic and understanding where that force needs to be applied and having that intent and being specific. So, yeah.
Well, intent is huge. And there are AVCA certified doctors, and I'm going to admit that I was one of them for probably the first 5 years, that I started adjusting animals that, I wasn't sure what I was doing. I didn't know why I was doing it.
Mm-hmm.
But I did it, and people said, oh my gosh, my animal looks so much better. Now, how long they lasted, probably not very long. And,
Mm-hmm.
and how much better they got, probably not like we get now. But did we get results? Yeah.
Mm-hmm.
Kinda, but not, we didn't get the shakes. We didn't get full body shakes.
Mm-hmm.
Horses, I always laughed, you got to get licking and chewing. And I'm like, well, that just means you fired a joint mechanoreceptor
Mm-hmm.
and caused a little endorphin release, but it doesn't mean you change brain. It doesn't mean you move the joint in the correct line, the correct facet angles to restore motion to that joint. In fact, some of the biggest licking and chewing I've seen is in some of the YouTube videos where the LOC is like 90 degrees off.
Mm-hmm. Mm-hmm. I just had that conversation with a horse patient because she goes, well, we've gone through a couple horse chiropractors and there's no one around me who does animal chiropractic. And so they're from out of town, they're from Minnesota, they're from wherever, like an hour away. there's a trainer in our area who $25 adjustments. I'm like, good. Yeah. You just take your money there if that's what you want to do. Like that's, it is what it is. Call me when you really have some problems. But she said that she was, well, we brought in this last guy from Minnesota, but he is so hard to get to, but he would come under the horse and like adjust like this. And he did the same thing every time. Like, I didn't see you do that. And I was like, yeah, because it wasn't indicated. I'm not going to do that adjustment just for the licks and the chews, or just because you saw it on YouTube, or just because that's what you're used to. Like, if that's not, there's a million different ways we can adjust this animal, but there's also like some correct ways that we could do it. And there's things that are actually indicated. So continually giving patient education is probably the biggest thing. And I think that was something like that I was really prepared for too, coming out, just doing training with you guys, is you guys had so many great, tips and tools that I could show chiropractic to my patients, and I could tell them and explain to them, versus just like cracking them and being like, see ya. It's like, no, that's not what we do at all. So yeah.
Yeah. Like, and it, and like I told you, it all boiled down to my mentor. One of my mentors was like amazing. He had the most amazing hands I've ever had on my spine. And his philosophy was bang on, and he would adjust me, and it was just like, and he would adjust a dog, and you could just see, but the owners never were told what he adjusted. They were never shown before and after. And when I started doing that for my own, because I would adjust and I was like, well, I don't know if I did anything or not. So I had to start doing some before and after stuff. And then my practice blew up because we showed your dog can't do this, now he can. How'd that $25 adjustment do? What it, is your barrel horse running faster?
It's funny because almost all of his clients, I think, are barrel horses.
Yeah. Are they running faster, or do you just get it done because everybody gets him to do their horse?
Yeah.
Exactly. And are you still on pharmaceuticals? I had a client that came to me every 3 or 4 months and then went to a lay chiropractor in between,
Yeah.
And she would run on an anti-inflammatory. And I said, why? You shouldn't need it. Oh, but he's still a little stiff and sore. Well, he shouldn't be. Do you, if you get a good chiropractic adjustment, that should take care of everything. We shouldn't need to be on those mind altering, pain masking, because the problem with those pain masking in these athletes is now you get career ending injuries.
Yep.
And that's not good for anybody.
And I've seen that time and time again, even with my athlete dogs, just my lounger at home dogs, but they start feeling better after an adjustment, but they're also on some sort of medication that blocks any sort of pain receptors or whatever it may be. And then they go ahead and they do something, that they re-injure something because they just push through it, or they're not aware to their body. And so we really have to educate parents on that, because they're not getting that education from anywhere else. So it's super helpful for pet parents too, just to remind them of what that actually is. What is that medication doing?
Yeah. It's huge. The side effects. I read side effects all the time now, even because I didn't read side effects on one of my son's seizure medications. And he had seizures for 37 years and went 10 days without a seizure. And then they put him back on his seizure meds. He had a seizure and died. And about 6 months later, somebody came in with a dog and said, hey, they want to put my dog on this medication. What do you think? And I said, oh, that's one of the drugs my son was on. And I typed it in Google, just like I always do. Google side effects of Lyrica. Seizures are one of the side effects of this medication. And I'm like, wow, I wish I'd have read that a long time ago. But I can't look back. I don't want to trip over things behind me, but going forward, it's important. What drugs is your pet on? Oh, he's just on. One I got the other day was we had a dog that wasn't holding his adjustment for an appropriate amount of time. What we thought. And we're like, man, there's something going on here. What drug is your medications? Well, he's on doxycycline because they think he had exposure to some tick disease. Well, that might be a good thing, and it doesn't have a lot of side effects, but it does tie up calcium. So if we're take a dog and if he's eating a kibble, dog food, there's a 94% of all dogs on kibble are hypocalcemic for whole body calcium, not blood calcium, but whole body calcium. And then we put them on one that ties up calcium.
Right.
What are the chances we have enough calcium for our nerves and muscles to work correctly?
Exactly.
Yeah. So, we got to understand. And so when we ask these things, it's not because we're nosy.
Right. Or like we want to cause a fight or like disagree or anything, but it just helps people think about things in a different way. Or I always tell people, I'm like, you should bring that up with your vet. Like being a chiropractor, that is probably like the one limitation, right? Is that I specialize obviously more in chiropractic versus the vet side of things. And so I always just refer it back. I'm like, ask them. Like, and if they have time to explain it to you, awesome. And if they don't, like maybe you might have to do your own research, but like you should really, really consider that because the research that I've done has shown X, Y, or Z, or like here's some great things to kind of chew on while you're waiting. So yeah.
Yeah. And that's and I always, one of my questions, well, we can't take him off because the vet said we couldn't take him off. And I said, okay, well then why are you here? And they're like, what do you mean? We want to get chiropractic. Well, if the drugs are working for you, why do you need chiropractic? Well, because the drugs aren't working for me. Then why do we continue to give them? That's something, if you were making an investment in the stock market and you invested $2 a day and you lose $2 a day, eventually you're going to quit. I hope,
Yeah. Yeah.
But if you keep giving your dog a pill and he keeps having the same symptoms and it's not helping, why do we keep? Yeah. How's that working for you?
That's like probably one of the things that drives me the most nuts in practice is just that they'll come in for chiropractic, but they'll be like, well, I'm going to still listen to this, or I'm still going to do all of these things. And I'm like, wait, are you going to do that or are you not going to do it? So typically in our area, the vets will say if there's an injury for whatever reason, they're like 2 weeks, here's some GABA, here's some, whatever, kennel rest, and just let it be for a little bit. Let's just see what happens in 2 weeks. And then they'll call my office and then they'll want to get in. And I'm like, I would much rather get you guys in right away and start actually figuring out what's going on versus just letting your body, kind of do what masking the symptoms. But sometimes they want to they want to do all these things or they want to jump in and I'm like, no, you're either here or you're there. We gotta be on the same philosophy of like, what are we trying to do? Like we're trying to help your dog's body work better. We want to make sure that connection between their brain and their body is doing the best. So no matter what happens, the outcome, it's that we know that they're fully connected and that their life is expressing as much intelligence as possible. And so once they kind of understand that, it becomes a lot better as far as patient outcomes, but it's a little tricky sometimes to get them to understand. So I think we've given up our healing power, even as people, and as animals. Like we forget that our body's smart and it heals itself. So.
Yeah. The biggest thing that we have to do as healers is stay out of the way.
Yep. Needs no help, just no interference, right?
Right. Yes. And we, and so what are interference? Well, thoughts, trauma, toxins,
Yep.
and people are like, well, I know they weren't poisoned. And I'm like, oh. Oh,
Me coming up with examples for that was funny because the first time that I got called out on that in a patient room, I'm used to saying it for humans, right? Like I'm like, oh, stress at work, at school, at home. And then I was like, emotional stress for dogs. I was like, oh, I actually have to like maybe it's loud noises. Maybe it's a new change. Maybe it's a new, a new dryer thing that you're using, or soap, or something in your house, or whatever it may be. But yeah, coming up with those examples, I think was to have on hand is helpful.
Oh, maybe it's even you got home 5 minutes late.
Yep.
I mean,
change your routine. Yep.
When you get home 5 minutes late, your kids they're probably watching TV or playing a video game, and they're glad you're 5 minutes late because they get to do what they wanted to do for 5 minutes more before you get home and get them to do what they're supposed to do.
Mm-hmm.
But your dog's like, I go pee at 5:02.
Mm-hmm. And somehow they know. They just know. This is the routine. Okay.
Yeah. Yes. And I pee at 5:02.
Yeah.
And oh my gosh, it's 5:15 and I haven't peed yet. And I don't want to pee on the rug, and I don't want to pee on the floor. And oh my God. I mean, how stressful is that?
Mm-hmm.
And then like we have one of our dogs was only gone from here for a month. She was literally born here. She got here when she was a week old, stayed here for 9 months, went away to get spayed, and then was supposed to go to her forever home, but something happened. And so a month later, she got back here.
Mm-hmm.
It took us 2 weeks to get her out of the kennel to where she would come out and eat on her own.
Oh.
We don't know what happened. And she still, it's Pink, and she still protects Dr. Amy like nobody's business. And I didn't, even Robert and I, we're here every day, right? And we come, if Pink's in the room with Dr. Amy and we start getting close, or she hears our footsteps, she starts barking. She's going to protect Dr. Amy.
Mm-hmm.
I didn't realize that it was just Dr. Amy until Dr. Amy was gone for a week. And it was quiet.
Yeah.
Like, Pink never barked. It was, when something was going on outside, yes, Pink barked.
Yeah.
But not like just when Robert would walk into the room, Pink wouldn't bark.
Mm-hmm.
Pink didn't protect me at all.
Yeah. Yeah.
And so how stressful is that she's, well, number one, that Dr. Amy was gone for a week.
Yeah.
And then number two, when Dr. Amy's here, she has to be on point all the time.
Mm-hmm. Yep.
Because she believes her job is to protect Dr. Amy. So
yep,
that's what she does. I don't think she'd ever bite anybody, but she's gonna let you know.
Mm-hmm. I feel like she might have been one of the. I might have had her for one of the dogs for a practical. Does she do practicals?
Oh yeah.
Yeah. I feel like my very last practical, I had her, and I was like one of the very last people, and she was like a little like, I'm over this. I just want to be with Dr. Amy. Like, you can please like leave.
Yeah.
A little vocal.
Yeah. Yeah. She yes. Yep. She's definitely Dr. Amy's dog, and she's been a class dog ever since she was, a week old. Students adjusted the whole litter when they were a week old. So it was like, and she's always been adjusted. And it's so funny because she acts like she doesn't want to be on the bail for the test.
Yep.
But she fights to be on the, like her and Poppy will fight to be on the bail.
That's crazy.
And
dogs are funny.
And so they're like, okay, let's do this, and Pink used to, she's getting better about it. But she used to absorb students' anxiety.
Yes. Yep. I remember that. I remember Dr. Amy saying like, you need to take a deep breath because like she will pick up on anxiety. So like, just check yourself.
Yeah. Yeah, she would. And then she'd always sleep in Robert's room after practicals.
Yeah.
And if there was too much anxiety in the practical, she would literally end up throwing up in his room.
Oh my gosh.
Overnight. Yeah.
Baby.
So Robert started like, oh, you guys had practice? Nope, not gonna do it. So
Yeah.
anyway, let's talk a little bit about ACEs.
Yeah.
How what did you think? And did
Yeah.
you like the program? And
Yeah, I feel like I recommend ACEs to everyone just because it worked for my schedule. Like knowing, so my dog fell out of my car in April, and I think I started my first module in May. Like I signed up that night for animal chiropractic, like through you guys that night, that she had fallen. And so I needed something that was going to be flexible because I knew I wanted to do it as soon as I possibly could. So I wanted the flexibility to do it online, and then be able to fly in. And I just liked that it was all like I could do that. I could work online. I could work at my own pace. I could get to the things in time, like the labs in time. But yeah, I loved it. It was so fun. And I think it's so refreshing. I think both you and Dr. Amy have such a broad chiropractic philosophy, and it is so refreshing, especially in chiropractic. There's a lot of chiropractors, I think, who don't have chiropractic philosophy. And so it's really refreshing to see someone else outside of the profession promoting that and really understanding the big idea. So I think that was really refreshing of supporting people who get that.
yeah, because I know there's a lot of, like I said, chiropractors, that don't get it. And when we have veterinarians here, and they say, well, how do I find a chiropractor in my area that is good? And I said, well, good and understand the principles are two different things. But if there's a better chance that if they understand the principles, they will do a good adjustment that you need. They will give you the adjustment you need. And so one of the things that I found is that you call around and say, hey, do you treat children? And if the first question back is, well, does their back hurt? You say, thanks for playing.
It's so true though. And I think, so like I said, in my area, there's no other animal chiropractors who are chiropractors who practice. There is a vet, but she does more like energy healing now. I'm not too familiar with what she does, but I just know that she does like energy medicine. And then I think there's one in Winona, but I've never heard anyone who goes to him or who has used him or anything like that. So, and they're both vets, and they just don't have the same philosophy because they don't have that same belief system. Again, like you're coming from a place of, do we believe that the body heals itself or do we not? Like, do we want to step in and heal that or do we not? And so I think that is a huge part of it as well.
Yeah. So it's like I say on the first lecture, I'm a veterinarian and I could teach in the middle, and most chiropractors would be happy with that. And most veterinarians would be a little stressed by that because it's still outside of their comfort zone. But I don't. We choose to lecture from way over there. And the chiropractors that go to a few schools are loving it.
Yep.
Veterinarians are outside of their comfort zone.
Yep.
And we've even had some chiropractors that go to some non-principled schools, really go through the 5 stages of grief almost when they're here. Because it's the 5 stages of learning, the 5 stages of, first off, you're going to get mad, denial. Well, that's not the way I learned it, so it can't be right. And it's like, it's chiropractic philosophy, the body above, down, inside out. That's just the way it happens,
Yep.
And then if they finally get to the acceptance, they become awesome animal chiropractors that are principled. Now, whether they're people practice, if they're chiropractors that comes over, and sometimes it does and sometimes it doesn't, and then they have this huge problem. The veterinarians that don't end up believing it becomes just a tool in their toolbox, and they don't, when we talk about what's your big wins, they're like, well, I don't really have a lot of big wins. We use it a lot, but there's not any big wins, because they're doing drugs and adjust, and a prescription diet, and maybe some acupuncture, and maybe some ozone therapy, and maybe cold laser, and I know one doctor that when you go to her for chiropractic, it costs about $800 for your dog. And people are like, what? Well, because she does, chiropractic and moxibustion and acupuncture and homeopathic remedy and some herbs and some diet, and trims the toenails, and maybe does some alpha stem, and maybe does anyway, just and it's you're there for like an hour and a half, and it's $800.
Yeah.
And people come to us and we're like, check their dog's spine, and okay, you're good to go. And they're like, it's only been 5 minutes. And like, yep, it's only been 5 minutes. And that's all you're going to do. Yep. That's all we're going to do. We remove the interference from your dog's nervous system. And we're going to do that 3 times. And then if it's not progressing like we want it to, then maybe we're going to look, why isn't the body able to heal itself?
Yep.
Maybe it's because of a nutritional imbalance. Maybe because it's some kind of scar tissue that's been there for so long. And maybe we will need to bring in some outside help.
Yeah. The same thing in our people practice. That's how we do. We say chiropractic first. Like, even if I know that they're going to benefit from, probiotics, or if I'm thinking like, oh, this is probably something we're going to have to address your gut health, whatever. But the gut is still innervated by our nerves. Like, we still need to clear that nervous system first before we can get, some accurate representation of like what's going on. So, yeah, I love that. Like, I like that approach. I also loved that we were able to take the program alongside other vets. So like, being a chiropractor, I had really no experience with the vet besides going to the vet for, our dog's health and stuff like that, But like, yeah, so that was really great, being able to take the program alongside of vets and understanding like the struggles that you guys are going through in practices, and what you guys are seeing, and how overwhelmed or underpaid or whatever it may be. There's a lot of similarities, and it was really cool to be able to have that experience, because I think and I know that they have more knowledge in as far as, anatomy and all of that stuff. But I feel like they're at such a disadvantage just with the chiropractic side of things, because knowing how to adjust is just so in tune to me. And it's like a part of my system. And so being there, I think you really have to have that like the philosophy in order to understand how specific you need to be with those adjustments, because like you said, they could go anywhere and they would just be manipulating the spine. And it's like, that's just not the point of that, but that's fine. So I really enjoyed that part.
Well, and 5 degrees difference. So the difference between, let's see if we can get that and that, those are 2 different listings. Those are 2 different subluxations. And, if we don't know what we're adjusting, we're going to be not adjusting it, Yeah. And people say, well, can you get over adjusted? And you have to define over adjusting, I think. I don't want you, if I come in to see you as a person, okay, I don't want you to adjust every vertebra that has a little bit of restriction. Let's adjust both ends and let me move around a little bit. Because those restrictions in the middle go away. And if you adjust everything, I feel beat up tomorrow, because I've been there. I've been to chiropractors that adjust oh, this isn't moving, boom. And I hear it click, or I'll feel it click. And it's like, yep, that needed to be adjusted, and they'll adjust. And then the next day I feel beat up. And I asked my chiropractor about 4 years ago, and I just told him one day, I said, I feel beat up. Let's just adjust my atlas and my pelvis and then see what happens. And he goes, well, that's not really the way I do it. And I said, okay. And I said, well, you can check everything.
Mm-hmm.
Tell me where I'm subluxated, and then adjust me, both ends. And then I'll walk around a little bit while Robert and Dr. Amy and sometimes students, we take students with us, get adjusted, and then I'll lay back down. And then you can adjust anything that's still subluxated, still not moving correctly. And he said, okay, I'll do that. He said, he said, I'll do that for a few times, but it's not going to work.
Yeah.
Now 3.5 years later, you know, we go in, he adjusts my neck. He doesn't even adjust my pelvis anymore. He just adjusts my atlas, and I get up and walk around. And my biggest problem isn't my SI joints. I have a recurring issue at L4, L5. And he'll say, yep, it's subluxated here. And I'll be like, I think you're going to have to do that one today, doc. And he'll go, well, let's see. And about half of the time, it even blows me away that I'll lay back down and he'll and it'll be like, does that still hurt? And I'm like, no.
Yeah.
It doesn't. But I'm amazed continually by my own body about how effective chiropractic is. It's like truly amazing sometimes.
Yeah. I think that's probably like people. I have noticed too, like my people practice seems to take a little bit longer for people to get some results. Whereas dogs, I can see immediately after that adjustment, they're like moving better, or they just look happier. They like, I swear to God, these dogs, like they just smile at you, or like the little light comes back in their eyeballs and you're like, oh my God, I don't even know your dog, what your dog is normally like, but this seems like this is such a better version of your dog than it is before they came in. And so owners are all the time, they just start crying of like, oh my gosh, like I haven't seen my dog this happy. Or we just had a dog the other day who started playing with toys again, who hadn't played with toys in a long time. And I'm like, that's amazing. Like, think about that quality of life of you never playing with your toys again because you're in so much pain, or you're tired, or you have no energy, or whatever. And now all of a sudden you can do the things that you love again. And it's like amazing. Miracles.
And the thing that I would truly recommend too is, so your dog is still playing with his toys. Your dog doesn't have any pain that you can see. All right. Get your dog adjusted, because one of the things that we've noticed that the adjusted spine is able to adapt to adverse environmental problems. That's what it's supposed to do.
Yep.
So we have a dog, one of our students' dogs, got hit by a car. And the car was doing about 30 miles an hour, never slowed down, just kept going. Rolled the dog yelped, and then came running back to the owner. And she was like, okay, wait a minute. Checked the dog. There was a few vertebral subluxations, adjusted them. And that was it. You know?
Amazing.
That if you have an adjusted spine, it will be able to adapt, because the subluxation isn't bad at the time it happens, because it is the body's reaction to stress.
Yeah. Yep.
And as long as it can happen, boom, but then we remove that interference and then it can react again. But if you don't remove that interference,
and we get that dysfunction, and then we have more problems.
Yes, it just starts building. So most people that first come to you aren't adjusted ahead of time.
Right.
And that's why it takes longer. I have been getting regularly adjusted for, probably about 20 years now. I wish I'd been 62 years, but no, I haven't been. But for 20 years. And I had a 15-foot fall. Landed on one leg, and I was 100% sure that it was broken. I mean, I could not put any weight on it. But we hobbled around, got stuff cleaned up. About 5 hours later, I went to the chiropractor, called up, said, "Hey, what time is a good time to come in? I think you might need to take x-rays." And he said, "Okay, we'll come in at 6." So we did. We went in, and my son Robert was with me, and we both fell. And he was okay. You know, he's 19, so had some messed up spine, but
Yeah.
And I could not put any weight on my leg, and I laid down, and he adjusted my spine. He checked my atlas, adjusted my pelvis, and said, "Okay, let's go take some pictures." And I stood up, and I said, "Why?" And he was like, "Well, because aren't we going to take pictures of your ankle because you think it might be broken?" And I was literally standing with all my weight on that sore ankle, and it didn't hurt. And I said, "You fixed it, doc." And he never touched my ankle.
Yeah.
But all pain is perceived in the brain. So there was some interference in between my ankle and my brain, and he removed it, and my pain went away.
Yeah.
So, yeah, it's amazing. The adjusted spine and the adjusted brain handles insults a lot easier.
Oh, absolutely. Yeah. Yeah. I'm trying to think. I thought there was one other thing I was going to say, but that story just reminded me of one that you told in class of how you thought you were having like a heart attack.
Yeah.
You were like, "I'm going to go get adjusted." And I was thinking your story, you were going to tell us that you weren't going to tell him you fell. You were just going to tell him to get you tuned up without getting x-rays or anything. I was waiting for that to be like, I just thought I'd see what he would find.
No, I told him, I said, "I need the x-rays, I think." And he said, "Okay." And he adjusted me. The one time though, I did stop in, I had a protection dog that couldn't bite. That was why he came to me. He couldn't bite. He was supposed to bite, and he couldn't bite. And anyway, the handler I know, and he's a pretty good handler. And anyway, I kind of joked with him. I said, "You think we need to muzzle him?" And he was like, "I got him, doc. And besides, he can't bite."
So we're here. Yeah.
Yeah. And one of the things about animals in chiropractic that you mentioned is that instant gratification, right? Yeah. Sometimes that's not so good. I said, "This might hurt." And he said, "All right, I'm ready." So I adjusted his TMJ, and he had a hold of him, and the dog growling, and I turned, and he let go because he thought I was out of the way, and the dog turned and got my arm. And of course, because he was a #1 bite dog, the guy said plots, and dog dropped, and so it didn't tear my arm up or anything, just 2 nice wounds.
Yeah.
And I thought on the way home, I thought, well, I should stop at the chiropractors, and because my neck is a little sore.
Yeah.
I thought I probably jerked, and but I was sitting in the truck, and I was like, I spilled something, and then, oh no, that's blood. So I'm still gonna go to the chiropractor. And I went in, and I kind of backed in so the people in the waiting room wouldn't see the blood, right? And the receptionist is there, and she goes, "What? You were just here, doc?" I said, "Yeah, I think I need to get checked again." And what happened? And I put my arm up, and she goes, "Let's just go in this small room over here."
Yeah. You would be, I feel like you would be my worst nightmare. Like, I'd be like, "What did you do today? What is happening? What do I need to like understand before?" I mean, I know I just show up and I, do my thing, but still.
Yeah. Adjust first, drug second, surgery third. So, what am I going to do first? Doesn't matter. I got bit by a dog. I got insulted by a virus.
Yep.
What's the best thing you can do for me?
Yep.
Adjust my spine. Then if I need something else, I didn't need stitches. It healed on its own. I didn't need antibiotics. It healed on its own. because when I got my atlas adjusted, it increased my T lymphocyte activity by 400%. It, boosted my immune system. It did all kinds of things. So,
yeah, no, I think, like I said earlier, people just forget that. People forget that our body was meant to take stress, and that stress is not always bad. It's just how we respond to it, and can our brain and body work as well as it can to process those insults, and then we're good to go. But yeah, we forget that our body's smart.
Yep. All right. How do I get a hold of you if I need my dog or my kid adjusted?
Yeah, you can find us. I mean, we're on Instagram, we're on Facebook, but my office is called the Hive Chiropractic Center. We have a location in Holmen, Wisconsin, and then Galesville, Wisconsin. We primarily see our animals and our people in practice at our offices, but we do travel for like farm calls. But you can find us on Instagram at the Hive Chiro or on Facebook at the Hive Chiropractic Center.
All right, everybody. Thank you so much for your time, Callie, today. Everybody, thanks for listening. And remember, the body heals one way and one way only, above, down, inside out. Keep your atlas adjusted and the rest will take care of itself. Thank you.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.